joined now by Arwa Damon, who's the president of INARA. It's a non-profit organisation providing access to life-altering medical and mental health care to children who've been impacted by human-induced or indeed natural disasters. And she joins us live from Istanbul. Arwa, in terms of the impact on children, on their physical health, on their mental well-being and their future, how devastating is this conflict? And would you say it's the worst you've ever seen?
Charlotte, it's incomprehensible to a certain degree. I mean, one's mind really can't wrap itself around the varying different levels of suffering that are especially being inflicted on children. We have to also remember that more than half of Gaza's population is under the age of 18. They are children. And many have said that this is very much a war on children. We have the physical injuries that are being inflicted by the bombs and the crushing of buildings. Save the Children is saying that every single day, 10 children are losing one or both limbs. That is a horrifying statistic. You have severe burn injuries, and we know from our experience at INARA, when children are burnt in the way that they are being burnt in Gaza, because we've seen this in other war zones, that requires years and years of lengthy and very costly treatment. And then, of course, you have the illnesses that spread and can be just as deadly as the bombs themselves. Look, tens of thousands of children under the age of 5 in Gaza right now have diarrhea. Diarrhea is the #1 killer of children under the age of 5, globally speaking, because of the dehydration that it causes. You have the spread of a variety of potentially also deadly chronic illnesses. Then you have the infections that are spreading because injuries are not being properly treated, because they can't have the proper sort of aftercare. You have doctors who are trying to deal with the pediatric cases that are coming in one after the other into hospitals and are quite literally having to triage a child with an amputation is no longer considered a priority because there are other children that need to get into the operating room and the meager resources of the operating room before that. And then on top of all of this, we need to have a conversation about the mental health impact that this has on a child, especially at such a young age. The trauma that these children are experiencing is not just a one-off horrific, scary event. The traumas are coming at them every single day, whether it's from the violence, but also we have to remember how traumatic it is for a child to be hungry, to be cold, to feel sick, to naturally want to turn towards their parents for some kind of reassurance, for comfort, for that pain to be taken away, and then to realize that either their parents aren't there or their parents can't take that away. The very structure that allows a child to grow and mature safely and in a positive manner has been completely and totally decimated.
Inara, how does that impact down the line their ability to function, their ability to relate to the real world? It just must be terrible.
I mean, realistically speaking, you can't relate. You can't function without proper treatment, medical and mental treatment. We've seen this from, war survivors past who never got the assistance that they need, and they are constantly haunted by their ghosts. They are not able to sort of integrate to a certain degree into what we call normal functioning society. And there is this tendency to want to relegate people who have been through this sort of trauma, who have survived war, to a life in the shadows, as if their lives were somehow over. What we also know through our experience at INARA is that most certainly is not the case. But these medical injuries, whether it's physical or psychological, require an intervention at as early a stage as possible. Because look, we're not going to reverse what happened. We know that very well. And when we talk about recovering from mental health, from trauma, it's not as if it all of a sudden evaporates. It's about giving a child early on the tools to be able to cope with their physical, but also with their internal emotional pain, so that it no longer is a roadblock to them being able to continue through a life of their own choosing. So it's no longer a roadblock or an obstacle to their dreams, to their capacity to build and develop a future for themselves. But what we're seeing right now, I mean, look, I've been a war correspondent for 20 years now. I've never seen anything like this. No one in the journalism or humanitarian space has ever seen anything like this in recent memory.
Thank you so much, Arwa. And I know that your organisation is hopeful that when you do get access to these children, you'll be prepared to help them. But yes, as you say, the level of need is just simply staggering. Thank you so much for joining us today. We really appreciate it.